Okay, so what if I told you that doctors could literally hold a patient's heart in their hands before they even make the first cut? I know, it sounds like something straight out of a sci-fi movie, but it's not. It's happening right now. This is holographic medicine, and it's taking us away from the flat screen. For decades, doctors have been stuck trying to figure out our incredibly complex 3D bodies by looking at flat 2D pictures. It's kind of wild when you think about it. But that is all changing. Medicine is finally leaving that flat screen, and you guessed it, entering a whole new dimension. We're talking about a world where all that complex medical data, it becomes this tangible, interactive hologram that you can actually walk around. It gives doctors this almost godlike view of our anatomy. It's incredible. So who's making this happen? Well, there's a company called ApoQlar, and they are right at the center of this revolution. What they've done is figure out a way to take standard, everyday medical scans and turn them into something, well, something extraordinary. Yeah, forget about squinting at those grainy images on a monitor. Just picture this for a second. A surgeon puts on a mixed reality headset and boom, suddenly a patient's brain is just floating right there in the room. A super detailed 3D hologram that they can walk around, peer inside, and inspect from literally every single angle. Okay, so what problem does this actually solve? I mean, it sounds cool, but what's the point? Well, to really get the power of this huge leap forward, we've got to look back and understand the limitations we've been dealing with. So think about the usual stuff. MRIs, CT scans, they give us a ton of detail for sure, but here's the catch. They're fundamentally flat. It's kind of like trying to understand a massive, complex skyscraper by just looking at its blueprints. You can see the plans, yeah, but you can't really feel the space, right? And that is the key question this technology answers. What if you could just step inside that blueprint? What if you could see exactly how every pipe and wire connects and truly understand the whole structure before you even think about picking up a tool? This is a fundamental shift in thinking. I mean, it's the difference between using an old paper map versus a fully immersive GPS that's guiding you turn by turn. That's what ApoQlar's software does. It takes that flat paper blueprint and transforms it into a living, breathing, interactive 3D model of a patient's actual body. And let's be clear, this is not just some fancy visual gimmick. This has real life-or-death implications, especially when you get into the operating room. Okay, just imagine this, a tumor, and it's wrapped tight around a critical artery. We're talking a situation where every single millimeter is the difference between success and disaster. With a 3D hologram, a surgeon can see exactly how those tissues connect. They can literally rehearse the surgery, plan the safest route for their tools, and suddenly, procedures that were once considered impossible, they're now becoming a reality. So how does it work in practice? The workflow is actually pretty straightforward, but totally revolutionary. You just take the patient's normal scans, the software converts them into this interactive 3D model, and then you use that model to map out the absolute safest surgical plan. And the result? The surgeon walks into that operating room with a level of clarity and confidence that, honestly, was just impossible before. It all just boils down to a really simple truth. For a doctor, seeing more clearly leads to acting more confidently. And for the person on that table, well, that confidence can change absolutely everything. But the impact here, it doesn't just stop with individual surgeries. No way. This technology is fundamentally changing the entire game of how medical pros work together and how they learn in the first place. Right, so think way beyond just one operating room. This is not a Zoom call with screen sharing, okay? This is a shared virtual space. A surgeon in Singapore and a top specialist in Europe can be looking at the exact same holographic organ at the same time in real time. It's like the world's best minds are collaborating as if they are literally standing right next to each other. And again, this is not some prediction for the future. This is happening now. Thanks to high-speed networks like 5G that can handle these super complex models without any lag, this kind of global medical teamwork is already a reality. And it's also completely shaking up medical school. It's like the difference between just reading a book about how to ride a bike and actually getting on one. Exploring a 3D holographic heart gives future doctors this intuitive grasp of anatomy that a flat textbook just never ever could. They're building real skill and muscle memory right from day one. So, where does all this go from here? Well, the momentum behind holographic medicine is just picking up speed, and the possibilities for the future, they are honestly mind-blowing. And look, this isn't some tiny little experiment. ApoQlar just recently locked in over $11 million in funding. That's a massive signal that the industry sees this not as some gimmick, but as a core part of the future of medicine. But the tech isn't stopping here. What's next? Well, we're talking about integrating AI to act like a smart assistant for doctors, helping them spot things they might miss. Pretty soon, you, as a patient, might be looking at a hologram of your own heart to really understand a diagnosis. And down the road, this could all merge with robotics and neurotechnology, opening up treatments that, today, feel like pure magic. It's really easy to get lost in all the cool, futuristic talk about AI and robots, but what's really at the core of all this innovation, it isn't just the tech. It's about something very human. It's about the simple but profound act of understanding. And if you think about it, medical history has always been about improving what we can do. But this next chapter, it's about deepening how we see. Because sometimes just understanding something, that is the most powerful tool of all.